All right, thank you. Welcome, everyone. Welcome to Future Africa. Thank you for making the time. Today, we kick off the Future Africa Fellowship presentations. The fellowship program is part of the Future Africa programs that we have here that seek to engage young Africans across the continent and across the world who are concerned about the development on the African continent and want to be part of the proactive movement in changing and making it a better continent. It's an 8-month-long program where we get to discuss national, local, regional, and even global policies, as well as development and projects. We've tackled discussions such as governance, corruption, elections, and several other topics. At the end of this program, which is where we've arrived today and why you're all invited, the fellows who you'll soon meet present policies they've been working on for the past months that address a particular need and a particular problem, either at a national level or a regional level within a particular sector. So today we begin our fellowship presentations with 2 policies this week, and then next week we'll also have 2 other policies. This week we'll look at National Maternal Health Policy of Zimbabwe between 2022 and 2032, as well as the education and skills developing talent and innovation of employability in Nigeria. With that said, I'll quickly introduce myself, as well as the team that's been working on the Future Africa Fellowship. I am Teranya Singinga. I am the Director of Programs. I am joined by Olem O'Brien and Elizabeth Obode, who are turning the cameras on right now. They're Future Africa Fellowship Program Associates who have led and steered the program for the past 8 months. Today, we are honored with our guests who are a panel of judges. Jacqueline Machangu-Motcho, who's the Country Program Officer for IFAD, Tanzania East and Southern Africa Division. Gérardine Mahoro, who is the GONAD Project Manager of African Development Bank, and more particularly the founder and CEO of ACT05. We are then joined by Salvatore Keshimana, the East Africa Desk Coordinator for the Political Affairs, Peace and Security Department, PAPS, at the African Union Commission. We then have Christian Nasu Elongue, who's the Managing Director of Cabot Group. Gladys O. Yiadom, a communications expert who was the former communications advisor at the Ministry of Digital Economy and Digital Transformation for the Togolese Republic. Kongere Denis, the COVAX Global Public Policy and Civil Society Engagement Officer for Gavi, the Vaccine Alliance. And lastly, but not least, Ifalade Juwon, the Petroleum Engineer at NNPC Exploration and Production Limited. We'd like to thank our judges for making the time to come forward and make this time to review the policy proposals and presentations that will be presented here today. For all those joining us who aren't familiar with Future Africa's work, today the fellows present 20 minutes, and then the judges will engage with them for 15 minutes in the Q&A, and then we'll move on to the second policy. With that said, I will step back and let the fellows we've come to see today take forward and present their policies they're proposing. We'll invite the Health and Society team to start.
Hello, all protocol.
I cannot hear him. I don't know if the issue is just on my side.
I think this is an issue generally across board. Achola, it seems you're having some connectivity issues. Apologies, seems to have some technical issues.
and good morning, depending on where you are tuned in from. Policy, International Matter. Okay.
All right, Cholo, can you try that again, please? Cholo, can you hear us? Apologies for technical difficulties. We ask for your patience at this time. Hello, Cholo, can you try again, please?
I think I should have to keep my video off. Am I audible now?
Yes, we can hear you.
Okay, thank you so much for being patient with me. Yes, all protocol observed. Good evening, good afternoon, and good morning, depending on where you're tuned in from. I am honored to introduce the Future Africa Global Health and Society Policy Task Force that wholeheartedly worked to put the national maternal health policy of Zimbabwe for the year 2002 to 2022 to 2032 together. So ladies and gentlemen, I present Ms. Fazana Ibrahim from Kenya, Ms. Mutoni Kahuho from Kenya, Ms. Nokulunga Ndlovu, our focal person in Zimbabwe, Ms. Kosinomusa Theodora Shili, another focal person in Zimbabwe, Ms. Ayanda Namfunda Mlongo from South Africa, and the only gentleman on the team, Christopher Korea from Kenya, and I, Achola Dina from Uganda. For network and connectivity clarity, we will keep our cameras off while we present. Thank you. And I now invite Nokulunga to give us a background of Zimbabwe and set the ball rolling. Thank you.
Thank you, Achola, for the stellar introductions. Good day all. I shall briefly introduce the country which the policy is proposed for and give a snapshot of the policy background. Zimbabwe has a population of 15.178979 million and ranks 150 on the Human Development Index. 40% of the population is living in extreme poverty, with urban poverty at 10% and 2.8 million citizens informally employed. The country faces high domestic and international debt, substandard infrastructure, inconsistent policies, a lack of capacity utilization, and political unpredictability. In the 2022 government expenditure budget, the health sector has been allocated 12.7%, which is 2.3% below the Abuja Declaration. As a result of the limited funding for health over the years, the country is lagging behind in achieving SDG 3 with a neonatal mortality rate of 31 deaths per 1,000 live births and under 5 mortality of 65 deaths per 1,000 live births, a maternal mortality rate of 614 deaths per 100,000 live births. However, efforts have been made over the years to align to the MDGs and now the SDGs. In the first decade of Mugabe's dominion, they had the advantage of inheriting a firm infrastructure and a robust economy, hence the strong primary healthcare, thriving network of teaching hospitals, and well-trained medical personnel. Accessibility of healthcare and social service in Zimbabwe were an inspiration to many countries in the 90s. However, the country plunged into an economic crisis due to the Economic Structural Adjustment Program and the country's involvement in the DRC war. The crisis was carried over into the 2000s, coupled with the HIV and AIDS pandemic, which saw to a drastic fall on health expenditure, compelling out-of-pocket payments leading to decline in life expectancy and increase in maternal and infant mortality. As a result, the donor-funded Health Transition Fund was established in 2012 to 2014 to tackle the reversing trends in maternal and child health for all citizens, which was also in line with the country's national health strategy of 2009 to 2013, and also the Health Development Fund of 2016 to 2021. This fund has, however, outlived its time span and its implementation was affected by the military coup of 2017, which saw to the coming in of the new dispensation government that is open for business. This has sought to the dilapidated health system and infrastructure, lack of skilled personnel, corruption, and fraud, among others. This policy therefore builds upon the country's Vision 2030, and particularly the National Development Strategy 1 of 2021 to 2025, which will be carried over from 2025 to 2030. That seeks to increase public health expenditure per capita from $30 in 2020 to $86 by 2025. Moreover, the motivation for this policy shall be clearly elaborated on by Ayanda. Over to you, Ayanda.
Thank you, Nagu. That was well said. Now, the statistics that have been shared by my colleague reveal that on average, pregnancy-related complications lead to the deaths of approximately 8 women per day, and about 100 children die every day from common and preventable diseases. Based on this background, the task force saw a great need to develop a policy that not only provides quality maternal health care, but holistically intervenes in addressing preventable maternal and child mortality. Every woman or adolescent girl child that becomes pregnant should have access to quality and holistic maternal care. This includes Anesu, who you see is happy to be expecting her first child. In fact, she's beaming with joy and has started thinking about names, about wearing matching outfits with her baby girl. Yes, it's a girl, but that joy suddenly changes to sorrow as she considers the maternal barriers and financial inconveniences that she has to face. This is where our policy comes in. Our policy has been created to deal with these barriers, creating a seamless process for Anesu. This policy offers comprehensive support to the mother throughout the cycle with a focus on full antenatal care for all mothers, which is care during labor and childbirth, and postnatal care to assist during the postpartum period to help with recuperation and restoration. Our policy also has maternal support services in diet and nutrition, along with mental health care for pregnant women and mothers of infants. In our next slide, we have developed broad and specific policy objectives that we'd like to share with you. The broad objectives are focused on achieving universal coverage of quality and comprehensive maternal health care interventions across the country, as well as improving responsiveness to the health needs of mothers during pregnancy and strengthening the health systems of Zimbabwe for better service delivery. The specific objectives are focused on, firstly, reducing maternal mortality ratios from 614 to 200 by 2032, reducing neonatal mortality rates from 29 to 10 deaths per 1,000 live births, as well as reducing the under 5 mortality rates from 75 to 20 deaths per 1,000 live births, as well as reducing mortality and morbidity due to malnutrition by 80%. Now, with that being said, I will now hand over to my colleague who will address the policy implementation timeline and provide the financial summary. Farzana, the floor is yours.
Thank you, Ayanda. I'm going to explain how we're going to implement this policy in just 10 years. The implementation of this policy will be done in a progressive manner with different milestones at different times. In the first year, we plan to establish this task force that will cascade down the administrative levels of Zimbabwe, the provinces, the districts, and the rural councils. This is to ensure their ownership of this policy and develop micro plans with them for how the different administrative levels are going to implement this in their understanding their different contexts and their needs. We're going to use the results-based financing model that has proved to be very successful under the HDF funding that we spoke about earlier. This is payment that is linked to both quantity and the quality of performance at the healthcare facilities. So understanding why are we doing this in a rolled manner? Because Zimbabwe has 1,800 health facilities, with 1,000 of them being clinics at rural district level, focusing on maternal and child healthcare. Announcing this policy will overwhelm the healthcare system as it is right now. So we plan to roll out the first phase only to 1/3 of the hospitals that have the capacity, and use that time to also develop the infrastructure for health facilities that are currently in bad condition. We also plan to use this time to hire human resources, recruit and train. Remember, we're saying we need comprehensive healthcare. That means we're going to need counselors to be there for mothers to offer postpartum counseling. Availability of drugs and supplements. It would be redundant to introduce free healthcare and then mothers don't have beds in these hospitals because there are no beds. So all of taking this time to also ensure there's availability of drugs, supplements, and beds in hospitals, and improving the entire healthcare system, and putting in place systems for reporting. How do we then track that we are achieving our targets? So using this time to put up all of these things, and between 2025 and 2028, then roll out to the remaining 2/3 of the remaining health facilities. In the last final 4 years, we plan to ensure there's continuous monitoring and tracking of progress, ensure any loopholes or any challenges and gaps in this implementation plan are quickly and promptly addressed, and provide solutions on the go throughout the entire process. So the big question is, how much are we going to use in terms of funding from the citizens to implement this free maternal health care? Currently, a health facility delivers 150 normal births and 15 C-sections per month. We are estimating that in the event that we introduce this free policy, people are going to seek these services, and we're estimating the number is going to go up to 200 normal births and 50 C-sections at the health facilities. The current cost of delivery for a normal birth is $30.76 for a C-section. We are proposing to increase this funding to 50 and 150 respectively. You will see the increase in number is also to consider the fact that we are offering comprehensive services. It's not just the delivery. So hence the increase in the amount per delivery. We're estimating the annual funding required for this implementation will be $100 million. Currently, the budget for healthcare is $363 million. This will not be enough. So we are suggesting possible sources of this funding. We said the Abuja declaration of 15% has not been met. We're going to push government to allocate the deficit of 2.3. When they fill it, all of it goes to maternal health care. So that will account for 66 million. We are proposing an introduction of maternal tax levy. Zimbabwe had a very successful trial in doing the AIDS levy to raise funds from tax levy on income to fund AIDS and HIV when they had the pandemic. And so we are also hoping to use this as an avenue to raise more funding for this as well. Zimbabwe has also recently successfully gotten $25 million through the global financing facility from World Bank, which will be allocated to this program as well. It's also very important not to forget the different stakeholders that have been supporting maternal health care through the HDF funding that has just ended in 2021. We're also hoping these partners see the initiative from government in implementing this policy and owning it, and continue with this funding and not to phase it out immediately, so that government can set up the free maternal policy. And so in mentioning the different stakeholders that are very critical to the implementation of this policy, I'm going to invite Chris to speak about the different stakeholders we hope to engage. Chris, over to you.
Okay, thanks, Fazana. So, while the Ministry of Health will take leadership in the implementation of this policy, it will do so in partnership with stakeholders, through a multi-sectoral approach at all levels. So we have the main key stakeholders that is the Interagency Coordination Committee on Health, which will oversee generally the national coordination of the policy. Then we have the Health Service Board and provincial and district health teams to oversee the policy implementation at provincial and district levels. And then we have the Rural District Council and the health center committees, as well as non-state actors, that including NGOs, development partners, private sector providers, as well as professional organizations. So apart from the stakeholders, we're also going to look at the next slide. What are the expected outcomes from the policy implementation? So we have 3 expected outcomes. One is to achieve universal coverage of quality and comprehensive maternal health care. So basically, how are we going to achieve this? This is going to be achieved through reducing maternal mortality, reducing under 5 mortality, as well as mortality due to malnutrition. Then the second expected outcome is improving responsiveness to the health needs of mothers during pregnancy. Again, we expect this to be achieved through the provision of quality ANC services and ensuring access to primary healthcare facilities. Finally, we expect to strengthen the health systems for better service delivery through upgrading infrastructure and improving the referral system, as well as having in place accountability and monitoring mechanisms. So I'll hand over to my colleague Muthoni to share with us on the next slide.
Thank you so much, Chris. So for this policy implementation and on how we are going to evaluate the different parameters on the success of the policy, first it will be to see an increase of the number of women, or an increase of the number of women who be registered under this maternal health program. And that means that these women will be seeking maternal health services in hospitals and in health centers and also in clinics. And the second one is also to increase the number of women who are seeking the number of maternal health services in hospitals, health centers, and in clinics. And in this, we also hope that there'll be massive campaigns to enroll more women so that at least more women can deliver in hospitals and also in health systems rather than them delivering at home. And lastly, we look forward to a reduction in maternal health, prenatal, and also neonatal morbidity and also mortality. And this also will ensure that there's an increase in the life expectancy. Thank you so much. And I hand over to Nkosi for the conclusion.
Thank you very much, Muthoni. Conclusively, based on what my colleagues have presented before you, I believe it is now evident why there is a need for a sound maternal health care policy in Zimbabwe and why this maternal health care policy must be implemented. Although Zimbabwe's Vision 2030 plans to increase funding for healthcare, there is no specific focus on maternal health. This policy therefore seeks to improve the lives of women and children. Like we all know, a pregnant woman has one foot in the grave, meaning there are a lot of difficulties faced by women carrying life. Therefore, let us be practical in mitigating the maternal mortality rate of Zimbabwe. Let us act now. Let us save lives by advocating and ensuring that there is free maternal health care services in Zimbabwe. Thank you for listening to our plea. Mercy Bikup, Asanteni, Siyabonga.
Thank you very much, Hawthorne Society. At this point, we'll now invite the judges to ask any questions or make any comments with regards to the presentation, but also if there's anything from the document as well.
Okay, can I go on?
Sure, go ahead.
Okay, so thank you so much to all the presenters for the presentation. Very well structured, very well organized. And I really appreciate the teamwork that transpired behind it. You know, it shows how there was synergy, there was coordination, internal coordination. Each one presented one aspect of the session. And I think this teamwork is to be encouraged. I think it's one of the things that we really need at the leadership and continental level. So basically, concerning some of the questions that I have, is the level of the measure that they plan to use to leverage, and to generate and to mobilize the financial resources that will be needed for the implementation of their policy. They talk at the, I think it was being mentioned about the maternal and a maternal tax levy, even though the idea is good, I was quite skeptical on the feasibility. So my question is, do participants have previous antecedent? Are there previous African countries who have in place the maternal levy? And what do they know about the challenges that they went through the process to put it up, and if it is still being applicable today? So that's the question number one. The question number two is at the level of the outcome. The outcome, I think it will be, the outcome are good, but I think it will be good also to probably add the time frame within which they would like to get those results. So I think those are the two feedback that I would like to share. Thank you.
Thank you very much. At this point, I'd like to ask anyone from one person from Health and Society to respond.
Hello.
Yes, sure.
Thank you very much for your comments. We will include the expected timeframe for each of the outcomes. In terms of the maternal tax levy, we haven't seen this, but there is in Zimbabwe itself an AIDS tax levy where government was trying to raise funding to combat the HIV epidemic, and they were collecting 3% of individual incomes and 3% from enterprises' profits at the end of the year to fund this. In terms of challenges, I think the biggest challenge was mismanagement of these funds, and it had to stop at some point. But it's also one of the aspects we are looking into to ensure there's accountability should we propose this and get approval. Thank you.
Okay, so thank you, Fazana. So basically, I think that the idea of the tax levy is interesting. Then it will be good in your document when reviewing it to ask to create a connection between this and other African countries. I'm sure if you do maybe a deeper analysis and research, you may find out other organizations, other countries who have also put something similar, maybe not necessarily in Africa, but maybe in Europe, but this could be part of something new that could be explored. So I'm not saying that it's not possible, but it needs to be strongly back up with evidences and other countries, the challenges, so that the feasibility could be more easily acceptable. So thank you so much and congrats.
Thank you, Christian. I'll now call on to Jacques to make a few comments, please. Thank you.
Saranya, can I add something?
Really quickly, then Ayanda.
I'll do it quickly. So we also had a look at Linda Mama, which is a program that was implemented in Kenya. And from that, we were able to identify some of the challenges that were experienced by the program. And that's why we ended up coming with a holistic intervention because of how we studied Linda Mama and how that was rolled out in Kenya. So we relied on Linda Mama when it comes to the African context, and we also looked at what was being done in Scotland when it comes to having a bit of a global perspective on maternal healthcare interventions.
Thank you, Ayanda. Jacques, I'll call upon you, please.
Okay, good afternoon, everyone, and probably good morning, depending on where you are. So thank you, Terania. Are we just supposed to do a Q&A now, or just for the presentation or the proposal as well?
It's presentations would be best. You can draw some things from the proposal document as well if you did have a question from that specifically. There's an opportunity to do both. Yes. Okay.
First of all, thank you. I commend the team for the work that they have done. I think it's great work, and the relevancy of the topic, it's still very relevant until today. I just had a few questions from the presentation, which I think you may want to consider. First of all, in terms of results-based financing, I think it's a good way to ensure implementation of policies on time, including the quality of implementation as well. So I think it's a good way to go in terms of the approach that the team has chosen. I see also that the team has recommended that they will be doing a fund mobilization of sorts from different organizations, and it's quite a lot. And I just wanted to find out from them if they've thought about what will be the structures of accountability, or are they going to use the same ones? Because obviously from the proposal, you can see the challenges with that. And how will the funds flow from, from one end to the other, particularly going to the local clinics in the rural areas? That's one. And one thing I think I'll probably need a little bit of clarity, and I'm sure it's there, but it's just not coming out very well. How is this policy going to ensure the reduction of maternal and neonatal morbidity and mortality? It's still not quite clear, and I think maybe you can speak a little bit about it to see the connection of how that's going to be reduced. And maybe later on I can talk a little bit about the proposal itself. Over to you, Terania, and the team.
Thank you very much, Jack. Would like to see if I call upon the Health and Society team to respond.
Thank you, Jacqueline, for your question and your comments. In terms of the flow of funding, I know it's the 170 million that's really stood out even when we were doing the calculation for the funding, but this was a 5-year funding and some of them are over 3 years. So it's not 1 year, it's to cover the entire period. In terms of the flow of funding, the team had a lot of discussions around this in terms of there's also low transparency and accountability within the government sometimes when such funding come from donor organizations. So UNICEF is currently the partner that was implementing RBF under the HDF1 that just ended. And the team, for implementation, we said UNICEF can be the partner handling the outside donor funding, but in the spirit of sustainability and creating Africa's capable workforce that can handle accounts as well, we had thought of the idea of having a person within the different committees that we mentioned, the province, the districts, and the rural committees, who will be in charge of accountability of this fund, like an accountant set up in the different locations to ensure that this funding is used in the manner that is appropriate. Under the RBF funding, what they do is they give the funding to the health center in terms of their budget for a month or for a quarter. And so this is also an alternative that we were also hoping to use for our policy, because when you give the committee in itself the ability to own the process and put the budgets in place, they know how best to use this funding and how to reach especially women in the farthest areas for specifically the rural setting. So they will plan which nurse will go to the different mothers to make sure that they come for the clinics and they bring their kids for immunization as well. In terms of how we're going to get to the outcomes, the main challenge we're seeing is mothers are inhibited by the prices they have to pay at the hospital. So if they know that they can come and seek these services for free. Yes, sometimes like in the Linda Mama case that Ayanda mentioned, yes, maternal health care was free, but mothers were not provided with all these other things. There was no bed, there was no water in the hospital. It wasn't even safe to deliver in the hospital. You may just as well deliver at home. And also the distances from the healthcare facilities was a challenge. So in making sure that the community now, if they understand that is their challenge, they get the nurse to go to the mother or plan something, like just making sure that that barrier is removed from mothers to access healthcare services. Thank you.
Thank you very much, Farzana.
Can I add in, Saraya?
Can we just check because of time? I want to make sure I can get Kongere Denis's question, then we can try circle back.
Thanks. I'm sorry, I've been struggling with my video all through, so that is why it's off. I think sharing my initial thoughts with the two judges that have spoken. Thank you, team, for the great work that has gone into the great efforts that has gone into this work. I like how detailed the presentation is, how it's contextualized to the situation of Zimbabwe, and also how you've also come up with the challenges that the policy want to address. So thank you very much. But also in terms of structure, there is very good flow from the background all the way to the implementation framework, which is really commendable. So few things. One is I heard during your presentation that you are thinking of maybe operationalizing this policy with few health facilities. And I'm not sure when I went through the proposal whether there was a criteria mentioned on how you will arrive at the health facilities to be piloted. I'm sorry if I missed that. So maybe some clarification of that would be welcome. The other thing is also socializing the policy. Normally when these policies are drafted within the countries that we live in, you realize that the people that probably would benefit from this policy the most rarely get the knowledge or the wind that there is some free, there's a policy that is trying to support the free maternal health. So I heard of the campaign, but also are there some other suggestions that you have to ensure that those women that are farthest left behind are aware of this policy and make good use of them? The other thing is also something around the traditional birth attendants. And I know we touched about this a while back when I attended one of your presentations, but I'm just wondering, how is the policy, how has this policy planned to deal with this type of service that also has been and is probably currently used in Zimbabwe? Lastly, it's about funding. And my suggestion, this is a suggestion, great that you've also identified or tried to come up on how the government will be able to resource this policy. I was just wondering whether, do you think that it would be proper to also break the funding as per the implementation phases that you will be undertaking, unless I missed that? So maybe if it's 1 year, how much will the government require for year 1, year 2, year 3, year 4, year 5? Thanks.
Thank you, Dennis. I'd like to call on Health and Society.
Yeah, Interanya, if I may share my insights.
Yeah, go ahead.
Okay, so I want to add on accountability.
Mm-hmm.
So first of all, we did share that as part of accountability, it is expected that the government will lead. But that said, we have the different levels. So we have the interagency committee, for example, that is supposed to oversee the policy implementation at national level. So we expect monitoring to be done at that level. Then similarly, we have the provincial and health teams. So again, for the provincial and health levels, we expect accountability to be done at that level. And then besides that, we have CSOs that are in the health sector that we expect to play their role of accountability and seeing to it that the policy is really implemented. And basically, with all those partners or levels, we believe accountability will be attained. And then on the question of the criteria of health facilities, to start with, we didn't mention that, but the thing is, with our reference to Linda Mama in Kenya, the proposal here is we should have the health facilities that have infrastructure in place starting, for example, in phase 1/3 of facilities that have the infrastructure in place and the systems in place. Then as we continue rolling out into the other facilities, that is the other third and then the remaining facilities, we are going to consider, as more infrastructure is laid, then more facilities will be considered for that. So that's from our guidance from the NAMAM implementation in Kenya.
Thank you, Chris. I just want to circle back and check in with Jacques if you wanted to make your other point.
No, I'm okay for now, Terania. I can do that later.
Nice. Nice. Gladys?
Yes, thank you. Thank you so much for the presentation. I think the other judges covered what I feel about it, really structured. And also I really like the fact that most of the elements that you brought to the table were backed up with fact, which is really important when we discuss topics like this. My question revolves around the coordination between stakeholders. So you mentioned a couple of number of them. And on this specific topic and within the different points that you mentioned, how do you envision the cooperation between the different stakeholders? Who would be the lead for those each objective that you mentioned, and how do you see the collaboration going? Thank you.
Muthoni, I saw your hand up earlier, or if there's someone else in the Health and Society team who'd like to answer. Muthoni, go ahead.
I don't know if I'm allowed first to answer to a previous question, or I should first answer what Gladys has just asked.
You can do both briefly.
Okay, thank you. So on the part of how we, on the first question on how we want to ensure that there's community sensitivity about the issue, in our cost and benefit analysis, we also had an administrative cost which was supposed to cater for the media campaign advocacy and also for health workers to sensitize and also to pass the message at the grassroots levels. So yeah, that's the first one. And the second one, how we plan to engage different development partners and also different stakeholders. Zimbabwe has had different maternal health policies put in place, and they have had a donor implementation strategy previously. So we were just hoping that we can leverage on that past experience to also roll out this one out. Yeah, thank you.
Thank you very much, Muthoni. With that said, we'll conclude questions for this presentation. Would the education team please prepare to share the presentation now?
Terania, may I say something?
Briefly as they're sharing the presentation.
Okay, thank you. Well, this is to just let everyone in the house know that our policy proposal is not a standalone proposal. It has been curated in a way that it integrates all the other health strategies currently in Zimbabwe to ensure that all of them work together for the good. Thank you.
Thank you very much, Achola. The education team, please, could you share your slides? Thank you there. Thank you, Lukman. All right. All right. Over to you, Lukman, and the education team.
Good afternoon, everyone. I am Margaret Braddock. I'll be introducing the whole education team and the country profile. So the work was put in, there's a lot of work that's been done throughout, and I have the honor to introduce every member and contributor of this project. Look, my next slide, please. So the contributors got utility, Wako, Lukman Yassin, Margaret Pajok, Alfred Akelere, Medfa Elkansa, Lerato Motsusen, Elton, and Nanaisi. Thank you, everyone. So I'll be talking briefly about the country profile. We chose Nigeria. Nigeria is a case study. And Nigeria has over 2 million people. That's the population of Nigeria is projected at 2 million people. And it's the 7th most populous country in the world. The background of Nigeria's education is currently at a place where we are, based on our research, it's quite poor. Nigeria's unemployment too can be linked closely to Nigeria's education, because based on what we have been able to discover, Nigeria's education system does not really allow for the possession of skills that are employable. Like there are skill sets that are not really ready. Like there are no skill sets that workplaces are seeking. So that's just it. The thing is, graduates are coming out of school without the necessary skill sets that would allow them to be employable and also will allow them to pursue entrepreneurial endeavors. So our policy is drafted based on this premise, and we intend to address the lack of those skill sets with the kind of policy that we're proposing. So currently, Nigeria's unemployment rate is set at 33% of, like there are more youth that are unemployed. So now we're looking at how education can play a part in enhancing both employability and innovation, as well as entrepreneurship in Nigeria. So I'll be handing over to Elkansa to speak about the four outlines that our policy is based on. We have structured it in 4 outlines. And Elkansa, over to you. Speak about the.
Thank you so much, Meg. Thanks a lot. Thank you. Hello, everyone. I hope you can hear me clearly. My name is Elkansa, and I work in project management, and this is my turn to speak about our policy proposal and the exact outlines, or we can call them dimensions as well, of the problematics that we wanted to focus on, and the types of regulations / solutions that we thought that we brainstormed on to be good solutions to the problems. Starting with talking about Nigeria, following up on what Meg was speaking about, it was very interesting to think about how Nigeria is the country with the highest GDP in Africa, and how it didn't reflect well on the level of education or investment within the education system in Nigeria. Unemployment rates hit 33%, sorry, in 2022. There's also a very large rate of school abandonment by kids, as well as problematics within the rate of investment within the education system. These are all points that we're gonna cover within the policy outlines. So the 4 dimensions or outlines of our proposal are: first, skill development and entrepreneurship education; secondly, curriculum review; thirdly, capacity building and specialization; Fourthly, increase in educational resources. Within the fourth outline, we decided to focus on three aspects. First is increase in funding and enhancing educational infrastructure consequently to this funding. Secondly, developing a balanced primary teacher to student ratio. Thirdly, controlling the rates of out-of-school children in primary school. Starting to speak about the first outline, which is skill development and entrepreneurship education. As you can see written on the presentation, more than 2/3 of Nigeria's 200 million population is under the age of 30. And so Nigeria is a very young country with a growth rate of 2.6%. Nigeria's population is projected to double in the next 30 years. This youthful population could give up Nigeria a massive economic boost if properly educated or become a threat to economic development in the near future. We put forward specific ideas on how we see that we can help with skill development and entrepreneurship, such as mainstreaming the development of entrepreneurship awareness and entrepreneurial behavior starting from basic school, and so including it within the curriculum, strengthening technical and vocational education training systems, reviewing all of the systems to see where we fall short, engaging in the private sector in technical and vocational education training actively, aligning skills agenda with the national policy on inclusive growth, making entrepreneurship an objective of the national curricula for vocational training and commercial schools of secondary level, introducing mentorship and coaching that comprises local entrepreneurs and business practitioners in secondary school to develop entrepreneurial skills. So essentially, we want to focus on entrepreneurial education on various educational establishments of the country, starting primary schools, as well as, of course, with a major focus on vocational training, because those that study within vocational training would be more likely to enter entrepreneurship for and create companies at an average scale. Yes. Secondly, we put forward the outline of curriculum review. It's what the stand of which we take is that the first focus point that we need to stand on is ensuring a thorough review of the curriculum as we strengthen, put a focus on STEM, science, technology, engineering, and mathematics in Nigeria's education. But before we get into any details in relation to any curriculum changes, we need to thoroughly review what the culture needs and what the job market as well needs, and include those needs into the curriculum, rather than follow with an international point of view on what should be included in the curriculum, meaning that the design of the new curriculum needs to be up to date and carefully designed according to the Nigerian economy's needs, as well as the social needs of the country. Thirdly, capacity building and specialization. It's integral. It's very clear that in order to, after creating a good curriculum, after putting forward all necessary resources, we need to ensure that we have the human resources needed within the system. And so capacity building and ensuring that the teachers and everyone that works within the education system has the right baggage of information and knowledge and skills necessary to implement the changes that come forward by the government. And so the recruitment of teachers from the top third of each graduate cohort, provision of appealing work conditions and competitive pay, accompanied by attractive career opportunities, will absorb and retain only the best in the teaching profession. And so brainstorming on how we can ensure that only the smartest of the Nigerian human resources are going to be interested in entering a teaching career. As well as monitoring and evaluating these initiatives to measure their progress and impact. And so all of the trainings of the periodic trainings that the teachers would have to enter has to be thoroughly monitored and evaluated. For the fourth and final dimension / outline of the policy proposal is increasing educational resources. As I started speaking at the very beginning of my presentation, Nigeria has the largest GDP in Africa. And unfortunately, the investment or the rate of investment or the rate allocated to education from the Nigerian budget from 2015 to 2019 was continuously being reduced across the years. And so it was 10.79% in 2015, becoming 7.9% in 2016, becoming 6.13% in 2017, and 7.14% in 2018, and then it's reducing again to 7.12% in 2019. As the UNESCO had already calculated for Nigeria needs to allocate a minimum of 15% of the country's budget as estimated for a healthier education system. And so one of our policy proposals is to, first of all, lead a study to confirm whether the UNESCO is on the right path in putting forward the number of the rate of 15%. We also need to lead a study to accurately determine the expenditure needed for the needed learning materials, develop an architectural plan to revive development infrastructure across the country, building needed establishments compatible with the rate of population in each area, lead an audit to predict population growth and plan for the needed educational structures accordingly in the regions where we are predicting the population growth. We monitor and closely supervise the process of expenditure on these newly developed projects to ensure that we control the levels of corruption and protect the money allocated to these new projects. And by this, we need to ensure the development of a digital system of monetary exchange to limit corruption at all levels, set up an investment fund to pour additional resources into the new infrastructure plan, develop an attractive investment regulations to attract investors. The second point that we focused on within this outline is develop a balanced primary teacher to student ratio. We believe that one of the most important aspects within the start of any within the development of any education system, it has to start from primary school. And Nigeria has a pupil teacher ratio of 37.55 as of 2010. Its highest value over the past 40 years was 46.09 in 2007, whilst the lowest value was 32 in 1978. And so for this point, we suggest to lead a study on the number of teachers available in each region / state of the country, to develop a plan of regular capacity building, collaborate with countries that have a strong education system to help develop curriculums of teacher training and capacity building, include newly graduated teachers in these regular training sessions. Third and lastly, of this last outline is controlling the rates of out-of-school children. I have to emphasize again that we chose a couple of aspects that we deemed to be one of the most important and influential when wanting to revolutionize an education system, or at least implement some changes. And so it's very important to ensure that children are at least getting their primary education. In 2018, 40% of Nigerians, and so 83 million people, lived below poverty line, while another 25%, 53 million, were vulnerable. The number of Nigerians living below the international poverty line is expected to rise by 12 million in 2019 and 2023. I mentioned these statistics because it's important to connect the strength of the economy with the out-of-school children, when ensuring that families are having enough money and that parents have access to jobs. They will more likely ensure that their kids are going to go to school. Very briefly, and so we put forward the following policy: building a team to thoroughly evaluate the reasons for these high school dropout rates, install social aid for students who cannot afford to be in primary school due to the harsh economic situations their parents live in. Thirdly, collaborate with religious entities in the northern parts of the country to include basic skills such as literacy and numeracy. Thank you so much. I hand out the rest of the presentation to my colleague, Luqman. Luqman, please do go ahead.
Okay, Al-Khansa, thank you very much for the wonderful presentation, and greetings to everyone who is here this afternoon or this evening. So our policy has been linking educational system to the employability of the labor market. And it's interesting that Nigeria is one of the most populous countries in the continent of Africa, and yet it has over 120,000 graduates joining the labor market every year. So the main question here is how the education system is prepared to allocate the very scarce opportunities in the labor market for the hundreds of thousands of graduates that are entering the labor market every single year. So we focused on the past 4 dimensions that Al-Khansa have talked about, with key policy recommendations on each. And now I'm going to take you through the policy implications and the expansion possibilities. I'll also talk about the stakeholder engagement so that this policy is reflected in the education system and in the employability sector as well. So through our findings, we found out that the current educational policy in Nigeria does not answer or solve the current problems Nigeria has, and that call is for a need to critically review the existing educational policy. While putting that at the back of our minds, it is very much advisable to give youth the highest voice possible, because they are the victims of the high striking and unemployment rates in the country. And moreover, most of them are lacking behind the requirements of success for this century. And by that, our findings stipulate, among other reasons, why the current educational policy was executed, that it was more concerned with using schools to develop manpower and labor for economic growth and economic development. So finally, we would like to talk about the proposed stakeholder engagement and the responsibilities of each. We came to the conclusion that connecting employability with the educational system is a multidimensional issue. And by that, we need to have different stakeholders coming in to engage and taking individual and collective responsibilities to make this call come up. So we came into the conclusion of having these four main initiatives or institutions to take up this policy. So the first one is the government, represented by the Educational Ministry, to be the lead in this project, because we've talked about curriculum review, capacity building for teachers, reducing student to teacher ratio. All this can be led by the Ministry of Policy, and it comes as a top-down approach. The second institution to take up this policy is the Nigerian Parliament, because so many policies that are developed are not passed as a bill, and they are not implemented because the Parliament have not taken up their role. So we call upon the Nigerian Parliament to consider approving this policy headed by the Educational Ministry, such that it becomes a lawful bill and it gets implemented. Thirdly, Nigeria has the Tertiary Education Trust Fund, TETF, and its main role is to provide infrastructural funding for tertiary institutions in Nigeria. So this will help the Ministry of Education know of the available resources and how best to use them. And then lastly, Nigeria has one of the most highest growing economies in the continent. And that means the private sector is booming. Business, private-public partnership is very important in this point, and this would help in investing in the young talents of Nigeria. So we hope if these stakeholders engage and take up their roles as stated here, it will do so much to reduce the current unemployment rate of Nigeria, which is 33%. This rate might not be as high as other African countries, but it still communicates the high population of Nigeria. So we bring our presentation and our policy proposal to this end, and we thank each and every one of you for taking their time to give us attention. So thank you very much, and bye for now.
Thank you very much, Yassine. We now call upon the judges to make their comments. Gladys, I see your hand is up. Please go ahead.
Thank you very much for your presentation. That was quite comprehensive. I think this is one of the conversations we had a little bit during our when I joined one of your session. I would say that I have a few questions about some of the correlations that you make. First, the correlation between the GDP and the investment rate, the education dropout. So what's the link that how do you back the link that you made between those two? You also at some point mentioned TVET and entrepreneurship, saying that those who are engaging in TVET education were most likely to indulge in entrepreneurship. How do you explain that? Are you able to back this with facts? And you made another correlation as well between primary school and employability. I mean, how do you see that work? And I think what I try to bring that here is the fact that the elements that you're sharing are relevant, but I would say it cover a wider range of topic mixed in between a lot of them, and it would be interesting to have a more structured ways of seeing that aspect, because of course when it comes to policy, there are lots of elements that are involved. And so there is need to make a choice. And I would say that in terms of problem statement that I identified through the presentation, the one that was maybe for me the most relevant was what Lukman said at the end. So you have an issue of graduates that are entering in the labor market. How do you ensure that they actually have the capacity to be employed? And I think that given the topic, it would have been interesting to start with this problem statement and find out ways to actually, decline your policy proposal based on this statement. Thank you.
Yes, thank you so much, Gladys. All of your questions are straight to the point. Starting to answer the first question, there isn't a direct correlation between the GDP and the rates of dropouts in primary schools, for sure. What I meant to say is I just wanted to point out that Nigeria has an economy that's growing, and it should reflect on the parents' ability to keep their children in school. And so it took part of the presentation rather than putting in a correlation between the GDP and the actual policy making. Could you please, Neferania, I'm not sure whether I'm supposed to answer all questions, or is there another team member who would like to answer a question?
If they can be brief, then sure, definitely jump in.
Oh, okay, so maybe I would add one more thing about the question on primary school and employability, and about school dropouts and employability. You know, schooling starts from primary, and if there is a high school dropout, it means we are losing so much potential that would eventually contribute to economic development and economic growth. And that is why talking about primary schooling comes to be very necessary. But we take that correlation at heart because it really does. So that was our line of thinking at the start. But your angle of analysis also makes a great deal of sense. Thank you.
Thank you, Lukman. Dennis, I do see you have a question.
Thanks, Taranya. Actually, my fellow judge, Gladys, has read my mind, because I was also struggling a bit with the nexus or the connections, but I would not go into that. So first, thanks so much to the team for the great work that has gone into this. I like how you're using the data to shape the direction and inform some of the recommendations that you've come up with from the policy. That is really great. On the context, I think for me, it would also be important to add a few evidence beyond the employment rate. I think employment rate is just one of them. That one of the aspects that you can bring to build the case. But I'm just wondering whether you could also try check into how even an employment rate features demographically, geographically in Nigeria. I think Nigeria is a very big country. So how does that manifest itself across demographics? Youth, yes, youth is a demographic, but are there certain ages that probably are affected the most? You look at geographical, how does that play around within the urban centers and rural centers? Because I think when we are also developing policies, it is important for us to look into how do we really ensure that the most affected cohort or citizens are also targeted by this policy. That is one thing. The other thing is also around stakeholder engagement. And I like the idea that the policy has also thought about how the stakeholders need to be engaged. One comment or suggestion for me here is also to maybe have more categorize the stakeholders. So it's a multi-stakeholder. So who are they? Are they NGOs? Are they private sector? Are they like development partners? But also because of the dynamic nature of these stakeholders, is it also possible for the team to look into different strategic approaches for different stakeholders. The other thing is around the policy landscape. So, and that also I think connects to the background and how you build your case. I read in the policy document, and a lot has been done in regards to the historical aspect of policy where Nigeria has come from. I think one important aspect is that what are some of the policies that the government has probably worked on, and what are the gaps? What are those things that the policy is not addressing that makes you as a team come up with this policy? So I think for me, I didn't see that coming out very clearly, and maybe you could look into that. Lastly, 2 questions from me. So what is the period or time frame for this policy? Ideally, it is important for policy to have a timeline for planning, but also for even just ensuring that we are able to track the progress. Lastly, is how then are you planning to operationalize this policy? Because I also didn't see that in the proposal itself, but also you've not spoken to it. Thanks. Sorry for speaking so much.
I'll let other fellows tackle this, and then Jack will have you after they answer. Health and education team, please go ahead and answer.
Okay, thank you so much, sir. For the first question in relation to the timeline, in all honesty, we did not draft a timeline, and I clearly can tell that each policy, each outline needs a different timeline as the problems need to be looked at a little bit more in depth. And so for skill development and entrepreneurship, I think we would need a timeline for the policies of maybe 2 years to 3 years. The curriculum review might take approximately also 2 years. Capacity building and specialization might take around 5 years to test the solutions. Increasing educational resources, if we speak about the research that needs to be put forward to learn about how much funding is actually necessary, I would assume that a study would take a year or so. But then for the infrastructure, for enhancing the infrastructure, it's a long-term plan. But yeah, once again, we did not draft timelines, the specific timelines, and so these are speculations more than anything else. So they're not very accurate. Could you please repeat the second question?
Thanks. I think the last question was about the implementation plan. So how are you planning to operationalize the policy?
Each outline on its own.
No, generally just more, not really a specific component of the policy, but I think normally, because it's more of an education and a bit of an employment. So how are you thinking around making sure that the policy works? So is it probably at the national level? Are you planning to work with some ministries at the district level or regional level? Are there certain departments or government institutions that you think would be critical in driving the policy forward? But also, if probably that is something that you've not thought through, no need to also belabor the point, but it's something that maybe you can take forward as probably you strengthen the document further. Thanks.
Yes, of course. Thank you so much. Lukman, do you? Yes.
Please. Yeah. Alfonso, thank you very much for taking up that question. Maybe I would like to clarify that we've put the time frame in the policy proposal, the document form, and we've proposed that this policy will be implementing in the next 8 years until 2030. But what we need to do is to segment the different dimensions according to the 8 years available. And we are thinking like, since this need is an international investment in education and there is needs for so many resources, there is a good line of opportunity to align this policy with the SDGs. That one maybe I will leave it there, but we'll take it in a good heart to clarify more specifically for each dimension. Finally, I would like to just draw your attention to more two questions. The first one is about the stakeholders. That one is clearly, it has been clearly described in the presentation. We've thought of having the private sector, the government institutions, and we even identified different institutions within the government, and then international organizations like UNESCO to take up this policy and help in implementing it. So we've also developed different strategies for different stakeholders. If you could read more deeply in the document, you will find that each institution or each stakeholder has his or her own role, and we've even put the implications that would come afterwards. So maybe if it doesn't come out clearly, we'll be able to revise it and put that more clearly on the document. So thank you very much for your questions, and we appreciate your comment as well. Thank you.
Thank you, Lukman. Jacques, we'll take your comment, and just a note to judges, we'll be calling on you just after this to give your review on everything. Jacques, after you.
Okay, thank you so much, Ntiranya. Thank you, presenters, for a great presentation. This is what you presented is actually a very relevant and critical problem facing many African countries today, not just Nigeria. But I really like, I think, on the presentation, amongst other things, that you placed youth at the center of the policy proposal itself. Because after all, they are the majority and they understand their problems very well. So that's kudos to you. Most of my questions have somehow been said in one way or the other, but I'm just going to say them anyway because I think there's a different angle to it. The first one is on the stakeholders. I like the idea that of engaging different stakeholders, especially private sector. But as you know, private sector are an elusive subsector and will only engage if there are profits to be made. So my question to the team is that as they, revise the proposal, I just want them to think a little bit deeper in terms of what will ensure private sector increase investments in education system, because they talked about, increasing investments in the education system. And how will that be different from what's already being done at the moment in Nigeria? Because I imagine private sector is already there and they're making some investments. So how will they increase even more? What will be the strategy for them to do that? And I'm saying this because oftentimes private sector engagement, we talk about it in programming and policy work, but it remains just on paper. You may have one or two that will come, forward, but only if they see big benefits ahead. But also it depends on how mature the private sector is in Nigeria. In my country, for instance, the private sector is still a bit nascent. So I imagine probably Nigeria being a very big country, that's what may be a possibility. But also private sector engagement usually also means looking at other related sectors as well. For example, financial sector. Because they'll need in low interest loans to actually invest in whatever sector that is, then for this case, education. So that's one. The other one, which I think the previous speaker also alluded to, is on implementation arrangements. I think it's largely missing, even though from the presentation, I did see some elements of it. But you may want to be a little bit more clear in terms of who will do what I don't know, maybe perhaps you expect to have, because sometimes when you do, a policy document or proposal, you'll do an action plan later on that actually articulates all of that implementation and how the policy is going to be operationalized. So that could be probably, maybe that's what you're going to do. But it would be good to highlight that a little bit. The other one is, of course, you're talking about increasing funds, investments, and in the education sector, and that's very clear. But how will that be done? How will the funds be mobilized? Where will the funds to reach an allocation of 15% come from if the government cannot do it now? So you'll need, I don't know if you can put that in the proposal to clearly highlight how that will be done. And also it would be good to identify a few places, donors, organizations that, you expect to mobilize these funds from. Over from me, Terania.
Thank you very much, Jack. I'll ask the education team to respond very briefly and then move into judges' comments.
Okay, thank you so much, Terania. Can you hear me?
Yes, we can hear you. Go ahead. All
right, okay. I'd like to respond to the last question on increasing education. How would that be mobilized? It's true we didn't put it in the policy, but going further, I realized that if Nigeria can sell 10% of its natural gas reserve through the Nigerian Liquid and Gas Company, that can be enough to fund our education in Nigeria, just 10%. And I think we are going to put it in the proposal. If that is done, then we can be able to fund our education to any level that we want. Yeah, thank you very much for every other thing you pointed out. We are going to look into that, then make those necessary adjustments in the policy. Thank you. I don't know if any of my colleagues want to say something.
Due to time, we'll stop there. Thank you very much, Godson. Appreciate it. I think we can add some more comments in the chat. But I'd like to call upon our judges. First, to start with Mr. Salvatore Nkeshimana. If you could provide us a couple of brief comments on both presentations, and then provide us with a grade out of 10 for both presentations, please.
Thank you. Thank you, Terania. The two teams, I think they have to be commended for the work well done. And I have no much comment to make, but for the first group on free maternal health, I think they need to include in the policy how it will be sold to decision makers, especially all stakeholders operating in the health sector, including the Ministry of Health, the National Assembly or Parliament, the government, and even if there is a trade union of health workers, I think they need to engage them. And the other recommendation I have to make for them, it is to maybe to explore what happened in some African countries who tried to implement similar policies. Maybe one example is Burundi, when they have a free maternal health. They have to do a deep research on how that policy has been implemented, what were the challenges faced, and to see how they can overcome them. Maybe this needs to be included in the policy. Yeah. The second group, I have no comment to make. Yeah, thank you.
Thank you. Mr. Salvatore, would you give us a grade out of 10 for both groups? So the first group, what would you give them out of 10?
The marks?
Yes.
Oh, I'm not, yeah, I think the second group, I think they included something on the implementation on the policy, which is missing in the first one. Yeah, so, but in general, the first group, I think the way it is drafted is more clear than the second one. So it is difficult to give some marks. It is what, up to 10, up to 20?
Up to 10.
Okay, I think, oh my God, this is a tricky question.
How about if I let you think about it and then I'll come back to you at the end?
No, I think I can give 6 for this, the first group, and 7 for the second.
All right, thank you. Thank you very much.
Yeah.
Thank you, Mr. Salvatore. I'll now move to ask Gladys Yiadom. Ms. Gladys Yiadom.
Yes. Yeah, thank you. Thank you, Terania. So for the different group, I would say for the first group, the presentation was clear with a right amount of ethos, logos, and pathos. So really mixing those elements, the emotions, the proverbs. I also really liked the clear correlation that you made between the different objectives that you wanted to reach. So it appeared really clearly, and the fact that you included SMART objectives as well, that was really appreciated. And I think the question that I asked and that the other judges brought is something that you may need to work on and maybe have a more precise view in terms of the timeline and the action plan, but it comes afterward, but make it more reflected in the presentation. But I would like to give you, I think 8, because I really liked the spirit that you put into the presentations, and I think it's good to acknowledge that. And for the second group, I really appreciate also the comprehensive aspect of your presentation. I could see that you're really trying to address this topic from different angles, which is true, and it's important to do it. I highlighted a few correlations because I think it's really important on those aspects to back them with facts and not just feelings. So that's why I asked those specific questions. So it's mainly the idea for you to, when you think in terms of the policy making, to really have this idea that some element needs to be backed with fact, that we all know about them, but it's really important to back them with evidence. But I would give you 7 because I think that you did the work. And for the element that are missing that my colleagues pointed out, I agree about the funding. I agree about the implementation and the relation between the stakeholders. And I would also maybe add a point that would be interesting to explore maybe a bit deeper. Godson, you mentioned the fact that we could mobilize funds from the resources. Again, thinking more widely in terms of the policy landscape, how you can make it happen. So always having this mix between what's happening within the sector that you're studying, which is education, and the impact that other sectors, basically what we call agenda setting. So how this can correlate with other issues also that other countries can have. So that would be my point. Thank you again.
Thank you very much, Ms. Gladys. I'll now call upon Mr. Christian.
Yes, so thank you. I think without repeating what the other judges have said already, I would just say thank you to all the fellows for the work that they have put into this. We do appreciate that it's not possible at the first shot to cover everything directly and do it effectively. So I believe it's a learning journey for all of them and for all of us also. We're also learning in the process. And as most of the members of the church have already indicated, we are there available to provide any additional support if needed. And also, they should finally integrate those that have already been shared by the various panel members. So thank you again. And if anything, we are available. Thank you.
Just a quick grade, would you give them out of 10 for both?
Yes, so the first group on the Zimbabwe healthcare system, I think I'll give them 7. And for the second group, 5.5.
Thank you very much, Mr. Christian. Thank you, Mr. Christian. We'll then have Mr. Ifalade Juwon, if he's still with us.
Hello.
Hi, yes, please.
Yeah, thanks, Tertiary. Before I go ahead, I'll ask to be permitted to grade only the second presentation because I came about 10 minutes late. I don't think it will be fair on firstly.
No, yes, sure, certainly, go ahead.
All right, so just a few things. Before I give a grade, I would say it's an interesting policy, considering I come from Nigeria. I can relate with some of the things that were said, and I can relate with the difficulty in scoping the policy. I can see they try to do a top-down approach, moving through like primary education all the way to tertiary. Sometimes it can be it might not be the best to, for policy making. If you go too wide, sometimes you can get caught up in the web of say stakeholder management and the number of components or elements that your policy would have. And I guess it was evident. My one recommendation for the group is to consider phasing some of the proposition into, say, short, medium, and long-term implementations. It might help actually give more clarity to how your proposal comes out. Good presentation, by the way. I see, some nice things done on the slides. And overall, I think I'll give them a 6.
Thank you very much, Mr. Juwon. Ms. Jacques.
Okay, thank you, Terania. I liked both proposals. As I mentioned before, I think they're very relevant in terms of the issues that the African countries are going through, not just Zimbabwe and Nigeria. The first presentation, I think the presenters were really prepared and very clear, and the presentation was well thought through from the beginning to the end, and I like that very much. I think everything came out very clear. There are a couple of things that they missed, of course, that I think we asked, and for me specifically, I did ask about, structure of accountability and the issues of providing, more clarity on some of the like reduction of maternal mortality, etc. But also, I like the approach of using results-based financing. And I'm saying this because, it's easy to see results. So you only give funds when you see those results. So I really liked that approach very much. And I think the World Bank in Tanzania is already moving towards that approach. And I think some development partners will be doing that as well. We do have that window in my organization. And I think it's good. And it's interesting because this is something that the NGOs have been using all along. You know, they'll only give you funds after they see that you've done something. So I like that, and I commend the team for thinking around that. So yeah, and of course, I mean, the comments that others provided as well, of course, they're very relevant. But the proposal, I felt could have been much better than what it is. I felt though it was all over the place. It could have. I wish I don't know that the amount of work and thought process that they actually put on the presentation, if that could have been done on the proposal, that would have been really good, because everything is actually there, but it's just that it lacks flow and coherence, you know. So I've made some of my comments, and I'll send it through once the session is over. But yeah, but I do like the presentation very much, and I think I'll give them a 7. On the second one, again, the topic is very relevant. The presentation did not come out too clear, and maybe not enough preparation, maybe not enough energy put into it, because when you're presenting something, you really need to capture your audience, to capture our interest, make us, you know, want to listen and to be interested. And I think that was missing, especially at the beginning or somewhere there. But you know, these are with practice, this can be done. Of course, my questions remain very much relevant in terms of being very clear how the different stakeholders are going to be engaged, particularly for private sector. And of course, the implementation arrangement, which again, they can decide not to necessarily actually put it there. That can be done in another, you know, document altogether, but it's good to actually see something. So yeah, those are my few comments. By the way, the proposal was good. I thought it was well written. But of course, for instance, things like implementation arrangement, that was not there. But I felt that it was well written. It was cohesive enough from the beginning to the end. You could see the flow, you know, the final flow, you know, big idea all the way, narrowing it down. I like that very much. And that's how it should be written. It's a proposal, and I think they did a great job at the proposal. So for the presentation, I'll give them 6.
Thank you very much, Jack. Thank you for that. I'll now call on to Kongere Denis.
Thanks, Ntaranya. I think, yeah, most of these comments my fellow judges have given their thinking, which I mostly concur with. I think, first of all, the two teams did a great work. Yeah, I think policy issues are never easy to deal with. It requires a lot of research, data, and just conceptualizing on behalf of government on what exactly probably the government will be able to deliver. So I think at a personal level, I really appreciate what the two teams have done and presented to us today. Not much comments from team 1 or the first presentation, but I think I read a lot of passion from the presentation. They were really passionate about issues of maternal health. And I just liked the arrangement of the presentation, the deck itself, with the use of, they might be really small things, but I think the way you presented information through use of infographics, I think means a lot. It's really simple for someone really to visualize and understand. And I think that is something I wanted also to mention. I think also on the same presentation and linking it a bit to the proposal is that similarly to Jack, I think the proposal had a lot of information, some which probably might not be very useful to the policy proposal itself, and probably could be used just as evidence to strengthen some of the proposals or some of the suggestions or recommendations we give to the government. So I think I also gave my comments into the proposal itself, and maybe you might think of taking out what is not necessary and just making the document really precise and clear. That's that also. I like the idea of the models, public-private partnership, the RBF, which are really encouraging. I'm just a bit worried with this result-based financing approach. Maybe I just didn't read it in detail, but given the situation of, given that health is really central to governments and communities, I'm just wondering a situation where we have this health facility that is not really performing as per expected due to many other reasons. So that means that also the financing that might be going to that health facility would be minimal as compared to the other one, but also those communities require the government to support them. I'm not sure really how best this RBF might work in that kind of situation, but it's a discussion for another day. Otherwise, I think that's all for me for group 1, and I will give them an 8. For group 2, I like the topic also. Both topics for me, I think, are really timely. There are issues that all our countries or African countries are struggling with, and the governments, I think they are really a priority to the governments that the governments of the day. And so for group 2, I like the presentation, yes, use of data to really justify why this policy is needed in the context of Nigeria. I think that is really great. Maybe a lot more on the same way other speakers have spoken about, more evidence really to strengthen the justification of this policy, because I think generally that is what a government would want to see, even if they have the data. But I think here we are giving a proposal to a government. So in as much as they understand it, but we want to convince them that really this is a grave issue that they must really put into consideration. And we want them to really consider the policy. And so evidence, I think, would be very critical, as some of the judges have spoken about. But also I think need to also include a bit of some of the suggestions that I think we have spoken about. I will not probably belabor that aspect of operationalizing the policy across the country. I think that is something that you can think through later on. From the policy document itself, I agree with Jackie, it was well written. Maybe, I think for me, and this is a comment to the two documents, we might also want to look into how do we strengthen the policy language. I saw a bit of active reporting, active writing, like we will do this. And I think from the policy paper, we might want to be a bit passive on how do we, and use a bit of the language that demonstrate forward-looking suggestions, but also not criticizing the government too much. Yeah, I saw a document that were, I think most of it, there was a bit of a criticism of what the government didn't do. And so I think also we might not want to discourage the government, and we don't want to see, I don't think we are also in a situation where we want the government to look at us as people who are a bit antagonistic, but we might want to come out as collaborators, people giving suggestions to the government. So I think that language might be improved, but generally, you guys did a great work in terms of writing and with very simple grammar. I will give the group 2 6. Thanks.
Thank you very much, Kongere. Denis. Thank you very much, all judges. Thank you for your for the grades you've given. This is a grade just to show what the feedback was as the judges saw in terms of your presentations, and more feedback will be coming through. Thank you very much, judges, again. Thank you, fellows, for the wonderful presentations and your policy proposals. Congratulations to everyone who's presented today. I personally have learned a lot through the process and through the presentations and policy proposals. We'd like to thank everyone who joined us today, who may have been connecting for the first time or who heard through this through various different channels. Thank you for making the time to go through with us. We understand we're a bit over time, but we'd like to thank all of our judges, Jacqueline Machangu-Motcho, Gérardine Mahoro, Salvatore Keshimana, Christian Nasu Elongue, Gladys Yiadom, Kongere Denis, Ifalade Juwon. Thank you very much for making time today, for sitting down with our fellows and going through the presentations and the policy proposals. We'll be reconvening again next week, same time, same place, same link. But this time we'll be talking about the South Africa's renewable energy sector and the East African Community Board of Governance. So we hope to see you then. But for now, please do take care and the very best of the weekend. Take care.
Thank you. Bye-bye.
Thank you.
Thank you very much, everyone.
Thanks, everyone.
Thanks. Bye-bye.
Bye. Thank you.